symptoms of COVID-19 typically do pass within a couple of weeks. Some people suffer long-term effects, even after testing negative for the virus. In our HealthCast today, I'm taking a closer look at the long-term impact and how healthcare experts are working to address these lingering effects. When Michael Jaar became infected with COVID-19 in late March, he went through the usual flu-like symptoms for several days. But even after testing negative for the virus, Michael began having pain and swelling in his joints and went to see a doctor.
He decided to test the fluid that they were, extracting from my joint, test it for COVID antibodies, and results came back positive.
Now for me, that was, wow, this condition can affect so many different things.
In essence, Michael was what is called a COVID long hauler, a term referring to people who, even after getting over the acute symptoms of COVID-19, continue to suffer long-term effects that are extremely debilitating. Rheumatologist Dr. Gaylis says the condition is estimated to affect more than 10% of COVID patients.
If you figure that as of today, 16.5 million people have been infected with COVID, that really means that more than 1.5 million people may have, quote, long hauler syndrome, which means that they're still suffering from one symptom or another that they never had prior to the onset of COVID.
Long hauler symptoms include fatigue, brain fog, muscle and joint pain, headaches, lingering cough, sensory distortion, chest pain, and joint inflammation.
And ultimately, any system can be affected by the way COVID stimulates the immune system and the cytokines to just go where they go.
In Michael's case, infusions of a drug used to treat inflammatory conditions like arthritis helped relieve the joint swelling and the pain.
It's been 3 months since my last infusion, and I'm, back to, knock on wood, back to normal.
Well, long hauler's condition can really affect anyone, by the way, regardless of your age or your health. It's been seen in both people who were hospitalized with COVID, as well as those with simply mild symptoms.